Like, share and subscribe for more videos, and don't forget to follow me on Instagram. In this video, we will be discussing about scalp. We will be discussing about the extent of scalp, layers of scalp, muscles, blood supply, nerve supply of scalp, and clinical anatomy. Scalp is a soft tissue that covers the cranial vault. Extent of scalp. Anteriorly, extends up to supraorbital margin. Laterally, the superior temporal lines. Posteriorly, up to external occipital protuberance and superior nuchal lines. Layers of scalp. Outermost layer is the skin, connective tissue, epicranial aponeurosis, loose areolar tissue. Pericranium. The first three layers of scalp are called the surgical layers or the scalp proper. The skin. Skin is hairy and contains sweat glands and sebaceous glands. Skin is the common site for sebaceous cyst. The next layer is the connective tissue, also known as superficial fascia. The connective tissue lies in between the skin and aponeurosis. It is dense and fibrous. Contains blood vessels. The blood vessel are adherent to the fibrous connective tissue. In case of injury, these vessels are unable to retract and get damaged, causing profuse bleeding. Bleeding is stopped by pressing against the bone. The next layer is the epicranial aponeurosis. It is also known as galea aponeurotica. This layer is freely movable. Contains the occipitofrontalis muscle. Wounds of scalp gape, if this layer is cut transversely because the aponeurosis is pulled, causing tension, in anteroposterior direction, by the occipitofrontalis muscle. The next layer is the loose areolar tissue. This layer is made of loose areolar tissue. Emissary veins pass through this layer. The next layer is the pericranium. The pericranium is loosely attached to bone surface and firmly attached to sutures. The sutural ligaments binds the pericranium to the endocranium. The occipitofrontalis muscle. It consists of frontalis in the front and occipitalis at the back of head. The frontalis has two bellies, wider and longer, partly united. The origin of muscle is from skin of upper eyelid and forehead. It is inserted into epicranial aponeurosis. Supplied by temporal branch of facial nerve. The occipitalis muscle has two small and separate bellies. It originates from lateral 2/3 of superior nuchal line. Gets inserted into epicranial aponeurosis. Supplied by posterior, auricular branch of facial nerve. Blood supply and nerve supply of scalp are discussed in next part of video. Thanks for watching.